to bring early detection of breast cancer to low-income communities, underserved communities, and communities that are right now below the radar in terms of healthcare. We see this as an epoch-making change in the delivery of healthcare.
The World Health Organization has recognized it as an innovative health technology. Over 1 million women are soon to receive a breast examination with the help of iBreastExam, many of them for the very first time.
We are delighted at launching this public health initiative for early detection of breast cancer lesions, which involves no drugs, no pain, no surgery, no radiation, and gives results in minutes. I believe this is a landmark development in access to healthcare. As I'm sure you'll agree, access to healthcare is a very, very serious problem in this country. People who fall below the radar, people who don't have insurance, people who have insurance but do not get this kind of tests done because of time constraints and scheduling constraints. Well, we bring the iBreast to you. We bring the iBreast, the handheld preventive measure. We bring it to you. We set up these programs in your neighborhood on a Saturday when it's very convenient. You can just stop by and get it done in 10 minutes. As of now, we have run 9 such programs. We have tested about 200 women, and quite candidly, I don't know how many lives we have saved. In Rotary, the issue is always, how big can you think? And that is, if we talk in terms of a community service organization, how big is your community? What is your community? Is your community the building you live in, the street you live in, the city, the village, the county, or the whole world? There was one man decades ago in Philippines who dreamt of the whole world as his community, and that eventually became the End Polio Now campaign of Rotary International. We started this program in 1987, at which time there were 350,000 cases of polio every year through the whole world. This year, there were exactly 2. That is the power of Rotary, that is the strength of Rotary, and that talks about the commitment and passion of Rotarians. Our program has spent about $2 billion on this, and that is only in hard cash. That's not including the innumerable hours put in and the resources and sacrifices made by hundreds and thousands of Rotarians all over the world. So the question when people ask me, what can you do with Rotary? I said 2 things. Number 1, anything that you think in terms of a community service or international understanding projects, anything of a public benefit, whatever you're thinking of, we can help you do it better and bigger. And secondly, the question is, how big is your community? How big can you think? Can you think in terms of your street? Can you think in terms of the world? Or somewhere in the middle? How big can you think? Think big, act big. That's what we're about.
Good morning, everyone. I'm Peter Spano, president of the Rotary Club of the Hudson Valley, and we're here today to share an amazing project with you. Today we're featuring our iBreast project, but I just wanted to share a little bit about Rotary with you. Rotary is one of the world's largest international humanitarian peacekeeping organizations, founded in Evanston, Illinois, in Chicago, by a man by the name of Paul Harris. And today we're in the Yonkers YMCA, one of my favorite places, and we're having this project free of charge for women all over the community. Please register, come join us, come get involved with some of the awesome community projects that we're doing here in Yonkers and all over the world, and we look forward to seeing and hearing from you soon.
Honestly, I hadn't had a breast exam in a number of years and was a little anxious and quite nervous. And as most women know, it's usually not the most comfortable thing to look forward to. But the iBreast experience was absolutely wonderful. There was no getting tensed up because it was quite effortless and painless. And as a result, I was relieved. We are so excited for this tremendous opportunity that's being provided by the Hudson Valley Rotary Club. I highly recommend it without hesitation.
So when I actually did it, I was very happy to go through it to end because it was painless. It was very quick. The examiners took, I don't know, 5 minutes for the whole process. So I was surprised how quick it was. The staff were very friendly. I had my sister do it. I told my other sister and my mom to do it, my sister-in-law. I encouraged them all to do it because I did it and I knew how painless and effortless it was. There's no radiation. It was just a really good experience.
I'm Jane. I'm a registered nurse and I'm presently volunteering with the Rotary Club to help do breast cancer screenings. We're using a new innovative machine called the iBreast. It's non-invasive, it's very easy, simple tool to use, very easy to learn, and most importantly, very easy and gentle on the patient, whether it be a man or a woman. This is the machine. It's actually, this is what goes on the patient. It's very soft. And we just use this to, it's sort of similar, but not really a sonogram. And use this, it will communicate with the phone. It is a nice, easy to use tool, and that we can at least introduce the idea of preventive care for men and women for breast cancer.
Well, my name is Llewellyn Cole, and I'm very proud and honored to be a member of the Rotary International. As you all know, the Rotary Club is responsible for lots of programs throughout the globe, and one of the programs that I'm here volunteering is the screening for breast cancer and lumps in women, which we all know is definitely a worthy cause. I'd like to urge more volunteers, if able, to come join and be a part of us.
Hi, my name is Sabrina. I'm a member of the Rotary Club of Hudson Valley. I'm a new member, and this is one of my first events that I'm attending and plan on attending many more.
Hello everyone, my name is Shadlin. I was given the opportunity to come to New York to do some initiatives such as the iBreastExam.
Hi everyone, my name is Kima. I'm passionate about breast cancer and cancer in general. My mom is a cancer survivor and I too had a cancer scare. And within low-income communities and other communities throughout, I find that a lot of people are not as strict about their health. So our point is to get out into those communities and kind of champion, just health awareness and breast cancer awareness so that we can continue and try to help save lives.